Kenosha County is reporting its first confirmed case of monkeypox. There are now 12 statewide. Health officials say the risk to the public is low since you really need to be in close, sustained contact with an infected person to get it. However, the World Health Organization has declared monkeypox a global health emergency. Sunday, Blaine Alexander shows us that the response inside the Centers for Disease Control.
As calls to strengthen the nation's monkeypox response grow louder and U.S. cases skyrocket from 1,400 less than 2 weeks ago to nearly 3,000 today, the World Health Organization has declared the virus a global health emergency. Dr. Jennifer McQuiston is leading the CDC's response.
How big is the CDC response to this virus?
Right now, we have over 300 people who are working on this response 24/7.
Rarely fatal, the virus is marked by painful lesions and sores spread through close physical contact. And while monkeypox is not new, the rapid spread is.
What's causing it now to spread in a different way than it has before?
We're coming out of COVID, right? It's been 2 years of people not traveling, not attending parties, not having fun. And I think there's some amplification of this that's happened as a result of people going out, living their lives.
And that spread, she says, goes beyond just physical contact, from respiratory droplets.
If somebody has lesions inside their mouth or throat, they could potentially shed virus.
To sharing things like clothing, towels, or blankets with someone with an open sore. The vast majority of cases are spreading among men in the LGBTQ community.
How important is it, though, that people outside of that community also don't close their eyes to this virus?
That's really important, as we know throughout history that infectious diseases don't stay in only one population. So perhaps it's been magnified early on in this population, but it could potentially spread over into other populations.
2 of the latest cases in children. A cornerstone of the CDC's response, more testing and making more vaccines available, all while still managing COVID.
There are only so many staff members at CDC, so when we stood up the monkeypox response, we had to pull people out of COVID.
She says if you think you've been exposed, isolate, then call a doctor and get tested.
We'd like to see the curve not keep going up, but flatten out and then eventually start to go down. So that would be my hope in the next 3 to 6 months.
And that's realistic if people take precautions now?
Yes.
Blaine Alexander, NBC News, Atlanta.